What happens after the kidney transplant? Post transplant care focuses on daily monitoring for weight, temperature, blood pressure, fluid balance, and blood sugar, watching out for infection signs, which include fever, chills, cough, and pain, routine follow ups and lab tests, medications. It's very important for patients to know the drug name, dose, purpose, frequency, and side effects. Identifying rejection signs. And through teach back method, ensure patients' understanding of medication adherence and ongoing monitoring. Complications in renal transplant recipients or RTRs include cardiovascular disease. RTRs have a higher risk of heart disease than the general population, though less than the patient on dialysis. Infection. Urinary tract infections are the most common source of secondary bloodstream infections. Cytomegalovirus infection, or CMV, is a viral infection may be acquired from the donor, reactivation within the recipient, or blood products. Malignancy. Cancer risk is 2 to 3 times higher in transplant patients, especially for lung, liver, kidney, lymphoma, and skin cancers. Rejection. Since the new kidney comes from another person, the body's immune defenses might see it as a threat and try to reject it. Anti rejection medications are used to prevent this, but they require careful balancing to avoid infections or other complications. What happens when a kidney transplant fails? While a kidney transplant can be life changing, it's not without risks. Unfortunately, transplants don't last forever, and there are several reasons why a transplanted kidney might fail. These include blood clots, which can block blood flow to the kidney shortly after surgery, fluid buildup around the kidney, which may compress and damage it, infections, especially in immunosuppressed patients, medication side effects. Some anti rejection drugs, which is essential, can be harmful to kidney tissue over time. Donor kidney complications. Despite thorough testing, issues with a donor kidney may go undetected before transplant. And chronic rejection, which is the most common cause of transplant failure. Over time, the immune system may slowly attack the transplanted kidney, leading to irreversible damage. What happens next? When a kidney transplant stops working, patients usually need to return to dialysis to stay alive. In many cases, patients may also be reevaluated for a new transplant if they're eligible. While many causes of transplant failure are beyond a patient's control, there are important steps recipients can take to help protect their transplant. Take all immunosuppressive medications exactly as prescribed and keep up with regular follow up appointments. Long term success depends on medical factors and how well patients care for their health post transplant. According to the National Kidney Foundation, kidney transplantation is a gold standard treatment for kidney failure, offering the best chance to improve quality and length of life. Discuss your options with your nephrologist to determine what's best for you. Thank you for watching.